some of these guidelines have shifted recently, and a lot of parents have been expressing frustration over just, I don't even think it's about the guideline shifting. I think it's just frustration wanting to scream into the void because we are, in our third year of this pandemic. But can you explain some of the rationale behind some of the recent updates to the guidance on quarantines and stuff, just so that folks know how that process works?
Sure. So I know it may seem frustrating and challenging, and where we're going as the science teaches us, as it learns. So early on, to 2020, we were concerned, or not really. We didn't know what the virus is going to do, and so we would say, yes, you should wear a mask. And then we weren't sure, and then we realized that there was masking that helps, and the coverings of the face, because again, it keeps this component, since we see that the virus is transmitted and likes the nose and throat space. So we said you should wear a mask. We saw along as we move along, then we said more well-fitting masks, not just a cloth covering, would be better. And as we see that you see less transmission with the tighter the mask, the better the fit. And so now after watching this now for 2 years, which is why we are recommending even the higher grade masks for people, so that you can again protect yourselves against that. So ideally, the N95s that are now going to be available in communities. If those aren't available, then the KN95s that look kind of like the bills. If that's available, then the tightest fit. So again, my son and I have smaller faces, so we were able to find on Amazon these surgical, the surgical mask types. They happen to be smaller fits with the nose piece, because we both wear glasses, so we can wear them tighter around our faces, and he can still talk, he can still run around, he can still do his thing. So that's how, when the science changes, the recommendations changes. We also saw with this current virus variant, Omicron, that it started to make people sicker sooner rather than later. So that's why we changed our recommendations to get tested 3 to 5 days rather than 5 to 7, because we saw this one was making people sicker sooner. So as the science changes, CDC's recommendations change again to help keep our community safe.